Hello. Welcome to another Spotlight the Science. My name is Marlon Pragnell, and I'm pleased to welcome Dr. Maureen Monaghan, uh, who will talk to us a bit about communication among between people with young people with type 1 diabetes who are emerging adults, and the challenges that kind of and the need for good communication to succeed in the transition to adult care. Maureen, tell us a bit about yourself.
Sure. Thank you so much, Dr. Pregnell, and thank you so much for the invitation to come and talk with you today. Really excited to highlight a little bit of the work that I've been doing supporting transition readiness for adolescents and young adults with diabetes. My background is in psychology, so I am a clinical psychologist. I'm also a certified diabetes care and education specialist, and I've worked with persons living with diabetes for over 15 years. Previously, I worked as an associate professor at Children's National Hospital and George Washington University School of Medicine in the diabetes program. I'm still affiliated with that program as volunteer faculty and an adjunct professor, but I also recently started a new position as program director for diabetes behavioral science at the National Institutes of Health and the National Institute for Diabetes and Digestive and Kidney Diseases. So here I really get to apply my research skills and knowledge to be able to advance behavioral science and behavioral science priorities, looking at ways that we can promote optimal health outcomes and quality of life for persons living with diabetes.
That's great. I think that with all the advances we see in medical care, medical uh, therapies, technology, um, CGM, drug-based approaches, and so on to improve care, but we're still not seeing, this improvement that we would expect with all these new developments. And you work on communication, and what's clear, I mean, from the reviews I've read that you've written, communication is such an important part of actually having individuals with diabetes be able to be aware of how to um, for self-care, but also too how to communicate with their providers, so their providers can guide them to better care. And most importantly and critically for you is more the transition when you have these young people that are growing up and leaving their care, largely help with their parents and going into the adult world. Can you tell us a bit about the issues there and how are you addressing those?
Sure, absolutely. And I will say that's really one of the things that drew me to doing diabetes research is that behavior plays such an essential role. We know there are medications and insulin and technologies, though I will say our adolescents and young adults are usually the least likely to be able to access these technologies. But behavior plays such a critical role. And persons living with diabetes make hundreds of behavioral decisions every day that influence diabetes management. And coming from a psychology perspective, we really try to better understand motivations and priorities in the context of someone's everyday life. Because life is not just diabetes, particularly for young adults. They're incredibly busy. They're taking on new challenges with family relationships, peer relationships, romantic relationships, education, living situation, just about everything else is changing. And then they also have to change their healthcare team, typically moving from pediatric to adult diabetes care. And so my work has really focused both on identifying the preferences and priorities and needs in that population, and really thinking about how the healthcare professional community can provide the best evidence-based targeted care and support to support this transition to adult diabetes care. And communication plays a really important role. We know that when both youth and adults have high quality communication with their healthcare providers, so when they feel like they're listened to, when they're engaged in treatment decisions, when they're able to ask questions and get answers to things that are most important to them, that's actually associated with improved health outcomes. And when you're thinking about establishing that kind of relationship with a new provider, that can be pretty scary and pretty anxiety provoking. So our work has really been twofold, particularly some of the most recent work that was funded through the Pathway program at the American Diabetes Association. So really trying to understand how we can help adolescents and young adults in pediatric care best prepare for that transfer to adult diabetes care. So to find an adult diabetes care provider. And not only that, actually show up to their appointment and engage in care and schedule a follow-up appointment. And also how they can really advocate for their needs in the context of that relationship that they have with their healthcare providers. We know from some of our communication work that healthcare professionals usually talk about twice as much as our adolescents and young adults in the context of their clinic visits. And while a lot of things are discussed, like lifestyle and nutrition and physical activity, sometimes there's less attention on these relevant topics for transition, like thinking about health insurance, like thinking about substance use or sexual activity, thinking about mental health and mental health concerns. And so we've really helped young adults identify questions that they might have for their diabetes care providers, strategies to encourage them to both plan ahead for these diabetes care visits and then raise these questions and advocate for their needs within the context of diabetes care visits and know what to expect when they get into adult diabetes care. And we recognize this is reciprocal. Healthcare professionals bring their own communication. Adolescents and young adults bring their own communication to visits as well. And it's often a reciprocal process where they build off of each other. However, communication is really a skill. And when you have parents who have been participating in the visits, or when there may not be that same developmental shift to really target information to adolescents and young adults, sometimes having some support and strategies and tools to be able to promote those communication skills can really help in the context of diabetes care and hopefully establish that engagement in care throughout the whole transition process.
Interesting. Yeah, I mean, when I think of young, my son, for example, an adolescent, almost like not saying much, becoming very quiet, looking to the parent to kind of lead things, in a medical setting, the doctor talking to the parent as opposed to the child, and so how does that? I mean, obviously that's appropriate at earlier stages, but as you become more and more older, an older adolescent, and you want to for transition, how do you get to the next stage where you start talking to the person, the young person themselves?
Yeah, and that's really something that builds over time. So there's never an overnight change. It's usually a process, and we really think about that evaluation of the transition process throughout adolescence and young adulthood. We know from some of our qualitative research that adolescents and young adults really do want to have conversations directed to them. Parents, of course, play a critical role, but the ways they provide that support might change. So they might be the backup information, the safety net, but not the primary reporters. And healthcare professionals really can have this shift. If you look at best practices for care for adolescents and young adults, particularly around this transition time, there are recommendations that adolescent and young adult patients are seen alone for a portion of their diabetes care visit, starting early in adolescence. And they may say they have nothing to say, but at least it sets the stage that they have the opportunity to have that private one-on-one time to have their questions and concerns addressed. There's certainly other strategies that can be helpful. So having question prompt lists or ways through the electronic health record that adolescents and young adults can indicate what questions they have, or even put a check mark for things that they're really interested in talking about that day. And that can guide conversation. Making sure that conversations are directed to adolescents and young adults, not just verbally, but with body language as well. If you're saying, I'm talking to you as a teen, but my eye contact is over to the parent, that's not really giving that clear message. And really asking open-ended questions. And we found that clinicians can start off a visit by saying, what's most important for you to talk about today? And even tell me something that's going really well with diabetes management, and then tell me something that's been a challenge. Making sure you're highlighting both those strengths and then priming them to think about something that they may want to bring up in the context of that visit.
Interesting. So she said we found. So how do you do research in this area? You said we find this, we see this. How do you get to the point where you say, oh, this is the best thing that we should be doing?
Yeah. So of course, my individual doesn't say the best thing. There's many people who are looking at this and really looking at policy statements and ways to advance best practices. But we certainly try to take stakeholder perspectives into account We've done qualitative interviews where we really ask adolescents and young adults what their experiences have been with their diabetes care, what has worked well for them in communicating with their diabetes care professionals, what are some areas that they think can change. My work has been with communication specifically. We've actually done some objective coding of communication where we've been able to record medical visits with everyone's consent and permission, of course. This is done within the context of research, and so it is IRB approved and they consent to participate. And we remove identifying information, but having that record of what happened in the clinic visit can really help us quantify communication that's happening, who's talking, what topics are being discussed, what questions are being answered. And then we can look at visits across a group of adolescents and young adults to look for trends. So not specifically what one person said, but in general, what are some of the common trends and themes that we've seen? And then we also use assessments as well. So we've had adolescents and young adults and their healthcare professionals complete questionnaires after a visit to be able to reflect on the support that was experienced, the level of engagement, their perspective of how clinic visits went, and their perspective of communication. So it's usually multiple ways that we're trying to pull together that thread to be able to look at what's working well. But the young adult and adolescent voice and parent voice and healthcare professional voice is certainly critical to driving that.
That's interesting. Yeah. So in terms of research, because a lot of a lot of this evidence-based research where you want to show evidence around things. I know sometimes a person would have a group would have a pilot study to see is this a good way to do this, or is this happening? Is this a better path? And ultimately we hear like recommendations and standards of care and so on, care pathways. And so how did a person, a group or a researcher will have an idea of an area to focus on. How, and they they'll probably get funding to do a pilot study. What is the next step to getting people to, or communities or countries for that matter to start implementing these on a broader scale? How does that unfold?
Yeah, research can take a long time, and I think you're certainly very familiar with that process of research that happens. There is rigor that needs to be involved at each stage of the research process, and usually you're building from your initial proof of concept work, so identifying a problem. For me as a clinician, so I was working to provide psychosocial clinical care for adolescents and young adults with diabetes, and in my conversations with them, really got to recognize some of the challenges and stumbling blocks of transition that made me say, well, let's think about some ways that we can address this, and always bringing in that young adult voice as well. So is this something that's meaningful for you? Is this something that you think we need to target? Is this something that you think is relevant for young adults? Building that into pilot studies where we can then, in a controlled setting, essentially recruit participants to participate in research and evaluate the outcomes that come along with it. And then there's always that ultimate goal towards translation. Can we do this across multiple healthcare centers instead of just in one? Can we do this in a pragmatic way where it's delivered for the information or the resources or the education or the intervention is delivered by people who are already part of your diabetes care team? Can we look at outcomes on a broader scale? And then is there enough consensus in the field where we can really coalesce around some really key practices? But I think it's always both that research and that experience from all of the expert clinicians that can come together. And there's been a lot of work on transition to adult care within diabetes, but we certainly also look for best practices in other areas as well. So it could be transition from pediatric to adult general health care. There's transition processes that happen in patients living with sickle cell disease or in oncology clinics. And so I think there can be some broad cross-cutting themes that also can guide those best practices. But I really do want to underscore the importance of stakeholder engagement, engaging with the community, listening to the community, and ensuring that you're really collecting the views and representations that are part of the community. So ensuring that people who are underserved or hardly reached in research, that their voices are also heard as well.
Yeah, that underscores the importance of research across broad range. I mean, when we think about research, we think about people with their test tubes and adding a little drop of this and that and combining things in a petri dish.
Yeah,
But there's research also behavioral as well that's so important to understand and
yeah,
improve care and actually ultimately all translate all these kind of discoveries that we have, and all this technology and therapeutic approaches to make sure people are actually best able to access them and so on. But one question I had though is you talk about communication. But communication is very different among different people and cultures, and so and that I imagine that could lead to health disparities as well in terms of like people talking to people in different ways and anticipating people to understand things in different ways, but they don't. Can you talk a bit more about that as well and communication in that
yeah.
respect?
Absolutely. So we certainly need to take context into account when we're thinking about communication. And again, understanding that systemic factors that drive communication, whether that's structural racism, systemic determinants of health that could lead to bias or disengagement from the medical system, cultural factors, whether that's language barriers, considerations for different populations, culturally based communication norms, and then also what's embedded within a specific healthcare system. So I do think that there are some models of communication that really can drive understanding the evaluation of those factors and understanding how that reciprocity of communication may need to be altered based on what an individual patient has for preferences, for goals, for motivation. Again, usually ensuring that you're asking open-ended questions and not making assumptions about what a particular patient might prefer, but really engaging them in a conversation about what's going to be the most helpful for them. And you can pick up on some nonverbal cues as well. So was that information, is this something that we need to ensure we're delivering in a written format and in a verbal format? Are there other resources that we might want to pull in? Do we want to make sure we're using a teach back method where we're really asking them, so I know I just gave you a few recommendations. Tell me what you heard. Let's make sure we're on the same page here. And is this something that's going to make sense for you? So there certainly are those cultural and contextual factors that need to come into play for communication. And it's complex, absolutely. But when we're thinking about something like transition, I do think there's some cross-cutting factors about preparation and development and acknowledging some of the normative transitions that happen relatively universally in the lives of young adults as they're moving towards potentially more autonomy or taking on new responsibilities or having those cognitive shifts where they are taking on greater responsibility for planning and problem solving and engagement. And the role of professionals and clinicians is really to meet patients where they are, not where we would like them to be.
Mm-hmm. So we're seeing then from both sides, really, isn't it? From preparing the young person who has diabetes to transition to adult care and all the guidance there and the way to communicate and so and in a cultural context, and then also too from the professional side as well. So the professional kind of better able to understand and guide those individuals as well. So I guess there's probably room for research on both sides, I imagine.
Yeah, there is room for research on both sides and capturing that interaction too. And I will say, there's a lot of young adults who do well with transition. So I think if you look at the broader research literature in this field in diabetes, it's about 1 in 4 young adults will have a gap in their diabetes care of more than 6 months when transitioning from pediatric to adult diabetes care. And there's multiple sources of support that they may have for the transition process, whether that's diabetes advocacy community, peers, family members, parents. So there are a lot of things that go well, but again, we can learn from the things that are going well and also see where we need to provide some more targeted support when challenges do arise. Again, with that ultimate goal in mind of both maintaining or improving health and well-being.
Very, very interesting. The approach is being taken. I when I think about all the future and the opportunities in terms of kind of improving or constantly funding research to improve technology better. insulin delivery devices, closed loop systems, therapies, drugs, and so on. And again, we're not seeing the uptake. We're not seeing this people could be a lot better at a lot better stage in their care. And so this seems like such an important area to emphasize this communication, because you could in my mind, you could dramatically improve healthcare and glucose control and prevent complications. So, with really effective communication between patient or person with diabetes and their provider. So, thank you so much. This is so interesting.
A cornerstone, and really appreciate the opportunity just to talk broadly about some of my experiences in this area and some of the work that's being done, and certainly appreciate the recognition of the importance of behavioral research and behavioral support in the context of diabetes care.
Yeah, it's wonderful. It's always a pleasure to speak to researchers in the field, and your work in this area is so much appreciated, and it's going to be so impactful. Thank you so much, Maureen, for this brief time you spent with us. Really appreciate it.
Thank you so much, Marlon. It's wonderful to talk with you, and thanks again to the American Diabetes Association as well for this opportunity.
Thank you. Good.